When COVID-19 first started spreading in the United States, the CDC put out a short list of symptoms to watch out for: fever, cough, and shortness of breath. That list of symptoms, though, has since grown. Dr. Reena Mehta joins us now by FaceTime with a look at the added symptoms. Good morning. How are you?
Good morning. Thank you so much for having me.
So good to talk to you this morning. So we're talking about some of these, how the symptoms have grown, and that's kind of, how science works. As you learn, you add more information to it. So let's talk briefly about some of these new symptoms that are now part of the official docket of symptoms of COVID-19.
Sure. So when we first started in this pandemic, what we were looking at was mostly patients who were hospitalized. And so we were seeing things more like fever, cough, shortness of breath. But as we're learning more about this virus, we're learning that there's more symptoms to look out for. So the three most recent things that they've added were nasal symptoms, so runny nose or congestion, nausea or vomiting, and diarrhea. And they've actually seen that some people, about those with some mild symptoms of COVID-19, can actually have diarrhea as their first presenting symptom.
Oh, wow. That definitely kind of changes things, especially when you consider, what we were told initially. That might have been something that people had looked the other way at. So something that is going to give people a little bit more information out there. We've got a lot of kids that are potentially going back to school soon here. Parents are eager to kind of figure out what's happening. You were talking about a new study that you were reading over the weekend that talks about kids and the coronavirus. What have you learned?
Right. So, as a parent, I can sympathize with all the parents out there. This is a very challenging time figuring out what to do with your children. And so the previous studies had shown that children, especially those young children, may not be big vectors of transmission of the virus. But in the past week, there's actually been a couple studies that have come out that have actually stated differently. And so one study published in JAMA looked at children that were less than 5 years of age. And what they found were those with mild to moderate symptoms of COVID-19 actually had 10 to 100 times more virus in their nose compared to those older children and adults. So it kind of makes you think that, some of the things we previously thought, again, new virus, we're learning new things, children may actually be more of a vector or transmitting this disease. And in fact, there was another study that just came out looking at a sleepaway camp in Georgia that happened in June, where they started the camp, and then within 3 days of having the camp open, there was a teenager who actually fell ill and then tested positive for COVID-19. So they shut down the camp, and then they went back and tried to test as many campers and staff members as they could. And out of those that they tested, 76% of them tested positive for COVID-19.
Wow.
So that's pretty surprising information, and it obviously shows that this virus can easily be transmitted amongst our children. So this is new information that, is different to previously reported studies.
And if anything, to me, that speaks to the importance of, teaching your kids, especially if they are going to be going back to the classroom in some form or way, to wear that mask, because even if they don't have those symptoms or their symptoms are mild, wearing the mask can help prevent the spread in a super spreader situation like that.
100% what you said. The one thing that we do know that has been solid throughout is wearing a mask and social distancing as much as you can actually works. So that study in Georgia, the campers did not wear masks. And so the staff did, but the campers did not. So that just shows you that if you can get your kids to wear masks, the chance of transmission of the virus is much, much, much less.
All right, some great information there, Dr. Reena Mehta. Thank you so much for joining us this morning. We always appreciate you with your insights.
Thank you so much for having me.